Our program really uses a multidisciplinary approach when it comes to adherence. When patients come into our clinic, they hear adherence messages from everybody.
I think it's important to understand that everybody I see as a patient is just like me, and treat everyone like that, and listen. I think listening is a huge skill.
And once they get to this point where you're not judgmental, you're here to listen to them and accept them the way they are, you can do anything together. It becomes like you said, like a partnership, friendship.
The key to HIV nowadays, it's medication adherence. Taking your medications properly is what's going to save your life. And the only way we can do that if the message is consistent, if somebody's on a regular basis asking you, reminding you how important this is.
Welcome to the Art of Adherence, meeting the challenges of antiretroviral therapy. Helping patients adhere to their antiretroviral therapy is among the key challenges for healthcare providers who care for persons with HIV. While it is up to the patient to take the prescribed antiretroviral regimen as required, providers have an important role to play in facilitating adherence. In this video, healthcare professionals share with us effective tools and techniques for counseling HIV-positive patients on adherence. 4 steps provide a way to help your patient establish a healthy relationship with their antiretroviral therapy and to help ensure successful adherence to ART right from the very start.
I see a new patient for the first time and they've just been diagnosed. I really work hard to help them get over the shock of the diagnosis and to help them get into care. So first and foremost, I assure them that they're not alone, that there are a lot of other patients out there who are experiencing or have experienced the same thing and have made it through successfully.
I tell them, you know, there is never an emergency to start ART. We want to start it as soon as possible. But if you want to do it, you want to do it right, because this is something you want to do for the rest of your life.
You know, when you first diagnose, even the first few minutes it's white noise. And I think one of the things that have helped me tremendously, or helped me when I was diagnosed a long time ago, is that my doctor actually had a plan. He took charge.
It's very important as a provider to meet the patient where they are. And from there, give them the tools or explanation to help them along the way. For example, if they are in denial, they might need some information that explain to them, you know, about how the virus act in their body and how the immune system is trying to fight the virus. What we want to do is we want to block this process. We don't want the virus to take over our T cell, which is our immune system. That's why we take the medication. If the virus develops resistance to one of these medications because you're not taking it on time or you didn't take the combination together, you might affect other medication in the same class. You kind of knock all this class out and you're left with very few choices.
I'm a trainer first who happens to be HIV positive. And what's good about that combination, it's that it's not necessarily about my life, but my insights that come through the information that they're getting. And the frustration of providers, clinicians, is that we have such good tools, but they're sometimes unable to convince somebody to use them. And one of the key things to really help somebody make that decision is to really use a couple sessions to talk about them and their lives, not necessarily about HIV.
The patient has to feel comfortable to come forth with the information, because I can't help them if I don't know what's really happening in their lives. So they need to feel that they can trust me, and they need to feel that no judgments are made.
I think it takes a lot to build this trust. That's why the initial work is important. You don't want to feel you're rushing the patient into, okay, you're here, we have to start the medication, you have to do, you have to do, you have to do. You want to kind of say, you know, I'm here to help you out. I'm here to listen to you. What are your problems?
Before I even get a patient on a medical regimen, I ask them what they do in their life. When do they wake up? When do they go to bed? When do they eat? What do you do all day? So you really get to know them intimately.
The patient has to trust you. You have to listen, and try and make the patient the expert so they understand what you're thinking and why they need to take the medications. And I think that helps.
When I talk to patients about starting antiretrovirals or not, I make it clear that I'm not going to start medications unless I'm clear that they're ready. The reason being that if we start medications and they take them improperly, it's actually doing more harm than good. It's actually leading to resistance where these medications will fail down the road. The key factor to let me know that a patient's ready to take antiretroviral therapy is whether or not they believe that the medicines are necessary or that they're going to work. So I right up front ask the patients, I say, you know, what do you believe about the HIV medications? What do you know about them? Do you think they're necessary? If you find out right up front that they don't even believe in the medications, they don't think they're necessary, they're not going to take them.
So one of the key factors that we look for to make sure that patients are ready to take medications is that they have some resources and that they have some stability in their life. So we want to make sure that if they are using and abusing drugs or alcohol, that we need to deal with that first before dealing with the medications. Another thing is we need to make sure what their home life is like and that there's not chaos there, that they're sometimes homeless or living in different residents, because then they don't have a single safe place to keep their medications to access them every single day. Another is that we want to make sure that they have the ability to pay for the medications in the form of insurance. And if they don't have insurance, then we hook them up with a caseworker who can help them to get these entitlements to get the medications paid for.
The way I explain to the patient, I say, you know, we're going to do this together. It's like a 50-50 deal. I do my part, you do yours. If we work well together, you're going to achieve your goal and beat this disease. Once they get to the acceptance piece, it will be, you know, they are halfway through the process. And then, you know, it's really about providing them with tools to, you know, move on.
I discuss with them their typical day in order to determine what's the best regimen for them. We find out what time they wake up, what time they go to work, what their typical feeding pattern is, and to help figure out what's the best medications.
If someone does not take any medications at all, it's very hard to start on a regime that you must take every single day. So you want to make it as simple as possible.
I like to use visual when I talk to patients. So I show them the list, a poster of all the medication that we have. The good news is that even though we have to take 3 different medication from 3 different classes, they come in combination. Sometimes 2 medication come in 1 pill, and sometimes 3 of them come only in 1 pill.
1 pill once a day antiretroviral therapy has been great. The patients that can take it, for the most part, love it.
I think it made it very easy on the physician to kind of help the patient to accept taking treatment for HIV, and it helped the patient with compliance, adherence, and hopefully, you know, sustainability, maintenance.
When I first start my patients on medications, I always discuss the possibility of adverse side effects. So the adverse side effects can be minor or they can be major. If the patients are aware up front that there may be adverse side effects, they're much more likely to continue to adhere.
For example, major will be rashes, important psychological or neurological side effect, lipodystrophy. These are major, and some of them cannot be reversible. The minor will be nausea, some GI upset, maybe some fat deposition. And then tell them some of these side effects will go away after a while, and try to reassure them. And then some of them we can monitor.
I always instruct my patients that if they should develop a serious side effect that requires them to stop the medications, that they must call me immediately so that I know that they're stopping the medications and we can take the next step to get them on a different regimen.
One of the things we try and avoid is to have someone be surprised about an adverse drug reaction and have a lot of anxiety about it.
I think it's important because when you're alone with a side effect and it's 10 o'clock at night and you can't call anyone about this particular side effect, you panic. So if at least I would have given some heads up about the side effect, I could wait until morning and not panic, not go to the ER for a side effect that really does not need ER care.
In order to help my patients adhere to their medications, I usually tell them to try to incorporate it into their typical daily routine. So to think about a time of the day where they're in a certain place and so they know they're going to not forget their medications.
One of my favorite tools is the organizer. And the patients love the organizer. It's a little black folder type book. It holds a cup that holds a pill. It has a pen in it, has a record of their CD4 and viral load, a list of all their medication, a place where you can put all that, a place where you can put all the cards for all the people that you need to call.
And we try to have things like pill boxes and beepers and different reminders for the patient so that they have some kind of an alarm system. And it's wonderful with technology nowadays. People can set their cell phones to beep when it's time for their medication so they can have their own reminder that they carry with them all of the time.
Part of good medical compliance, besides taking your pills, is coming to your appointments. And that's really a good indicator also about whether a patient is going to do well on their medications, is do they keep their appointments? They need to know what their T cells and your viral load are doing, and they love to know if they're undetectable. But they also need to know if there is something not going right, which they might not feel. So every 3 months, it's important to have that monitored.
When my patients first start taking their medications, I monitor very closely to make sure that they're taking them properly. First of all, I will ask them if they're taking the medications and how they're taking them, having them describe to me how they take their medications. That gives me a chance to see if they're really taking them by forcing them to describe what time they take the blue one or what time they take their certain medications.
It's really important to follow up with the patient after you've ordered the medication because many of them may not have even picked up the prescription so that they didn't even start. And you want to have an accurate time for when they started because that determines when we'll do our first blood work to check if the medications are working. So we really need to know when they actually started.
Basically, I try to do at least a contact every 2 weeks in the beginning until we have the first blood work, which is usually in 4 weeks. We'll do one CD4 count, one viral load, and then we'll discuss the result. And this is usually a very good push because they feel, oh, wow, it's working. So it's going to give them some sort of enthusiasm that, wow, I really can do that.
One of the things that we use to help teach our patients about the virus and how they can improve upon it is a viral card. And on this viral card, we record the date that the lab work was taken and the viral load and the CD4. To help you understand what we want you to do with these numbers, we want the viral load to go as low as it can go. So I'm going to indicate that by putting an arrow down over that one. The CD4, on the other hand, we want to go as high as it can go. So I'm going to indicate that by putting an arrow up.
The consequences of missed doses with HIV infection are really greater than with other diseases. I explained to them that missing doses with HIV infection can lead to resistance. The medicines can fail, and down the road we may have to switch to different medications, which may end up being more pills a day, more side effects.
A lot of times when we say perfect, it's not the same perfect that the patients hear. They think perfect is good enough if they miss it a few times a week. But with antiretroviral therapies, you really can't miss a few times each week. So perfect means in antiretroviral therapy taking 95% or more of your medications every single week, every single month. So that really translates to hardly missing a dose more than once in a given month.
After their 1-month visit where they need to get blood work to make sure that the medication is not interfering with any of their systems, then they're usually followed every 3 months. That's the ideal thing.
So you want to be clear on what times they're taking the medications and what they're taking together, so that we can always correct our medication list.
Also, a good check is to have them bring their medication in. They could be doing something wrong for a long time and maybe no one picks it up. You know, they might have picked up their meds from the pharmacy and the pharmacy made an error and didn't give them one of the meds.
The other thing is to always stress to them with the antiretrovirals that it's an all or nothing regime. That if you're missing part of these medications, it's very important that you have the entire regime, or resistance can happen if you're taking part of it without the full complement of meds.
The maintenance phase can be a challenge by itself because, what happens is sometimes when the patient, they start feeling, oh, this was not too bad. I was able to take the medication, I became undetectable, I'm gaining weight, I'm doing well. They not taking it for granted, but they feel it's like it was not too difficult to get there, and they start slacking a little bit. And the way to assess it concretely without really, having the preaching style, ask a very specific question. Are you taking your medication every day? And they say yes. Are you taking them on time? They say yes. What time is that? And then the third one is, have you skipped a dose at any time? They say no. Not even one time. Not even when you were on vacation, you told me you went on vacation. Not even that weekend when you were with friends. So, and sometimes they tell you, actually, I did, or I forgot to take it for 3 hours and I woke up in the middle of the night and I took the medication. So it's very important to go back to the specific and a specific question.
Fatigue is very real. I don't care how much knowledge you have. I don't care how long you've been doing it. You could be doing it for 20 years like I have. And one day you say, I had enough.
One of the things that I find that helps patients deal with treatment fatigue and helps them maintain tight adherence is just to show them how well they've done. Show them a graph, or show them numbers, or show them their CD4 cell count. Show them that their CD4 cell count is continuing to rise or plateauing at a nice healthy level. Show them that their HIV viral load is undetectable. Discuss some of the opportunistic infections that we're not seeing, and why that is.
It's been several times that I've chosen to stop all medications, all HIV medications, mostly because of depression. And when I made the choice to stop medications, I ended up in the hospital with 0 T cells and over 1 million viral load. So, which made me realize that these medications really are helping me live. Because until that point, I don't think I really believed that these little pills were actually doing all this amazing work.
In order to help people adhere to their medications, we think it's really important that they feel good about themselves and that they are moving forward with life. We offer really some innovative and exciting programs, including photography groups, self-help groups, consumer advisory groups. By encouraging people to join these types of groups, it makes them feel better about themselves, and they're much more likely to continue to adhere to their medications because they're enjoying life now.
I have found it rewarding and important for patients to see a well-educated advocate, because if they're talking to someone who's well-educated in the subject, they can do much better. They can have hope. They can see the future in your face, especially if they're just starting the journey. They know maybe what to expect. They know that there's hope. There's light at the end of the tunnel.
If I could tell my colleagues one thing about improving adherence in their patient population, it would be to try to create a culture of adherence in their clinic or in their office. When patients come into their office and they see that everybody's discussing adherence, they're going to catch on that this is an important thing.
It doesn't start or end by writing a prescription. It's really it has to be patient-centered and not disease-focused. We have to meet the patient where they are, at which stage of the disease, and do a lot of work up front, and then close monitoring is key.
Part of our role is to be their cheerleader for this component of their care, is that we really have to keep them motivated and keep them positive and show them encouragement for taking their medications on a regular basis, and demonstrate this by showing how good their viral load is and their CD4.
When I talk to the patients about their medication, a lot of times they tell me that they look at the medication and they think about HIV, and they just can't bring themselves to take it. And it's those times that I say, you need to make friends with that pill. That pill is your friend. It's helping you stay alive. It's helping you keep your immune system alive. You have to change your thinking about that pill.
I think if you keep it simple, it may be trite, but if you treat every person as you would want to be treated, I think in this case it really works. Compassion is the key.
I know the medications are keeping me alive. I know that for a fact. It is a fact that I have to accept. And once in a while, I want to get rid of them. Once in a while, I don't want to take them. Once in a while, I need help taking them. Once in a while, I need encouragement to take them. Once in a while, I need to hear from my physician, please don't stop taking your medications. Because I know and he knows that my life will end, and I'm having too much fun.